Well, it is 10 o'clock, and so we will get going this morning. Thank you all for joining us on another edition of our TFND Webinar Series in partnership with the Department of Health Tobacco Program. Today, we are going to discuss cessation. So we're going to talk about ND quits. We've got a couple of guest speakers for you. And I will go ahead and get started here. Just a few fun facts about ND quits. The quit line started in 2004. It is all one word, ND quits, no spaces in there. And we have a unique relationship with our quit line. We have a vendor, National Jewish Hospital out of Denver, Colorado, and introducing Katie Carradine, our accounts manager there. She will be speaking first. And they partner with the counselors who are actually located in North Dakota on the UND campus. And so we have a couple of our counselors here as well. So I will go ahead and turn it over to Katie to introduce herself and tell us about the National Jewish Health side of things.
Thank you. Good morning, everybody. Can you hear me okay? I just want to make sure you can hear me. Okay, great. It's great to be here. It's great to talk about, I always tell Neil, my favorite client, which is North Dakota, and that is not a stretch of the imagination. It's absolutely fun to work with North Dakota. Really great to talk about what we do at National Jewish Health. So I think if I can share my screen. Oh, hang on a second. Sorry. Sorry, hang on a second. Let me try one more thing. Okay. Can you guys see that? Can you see the presentation?
Yes, it's coming through.
Great. So really excited to talk about the North ND Quits program today. As you mentioned, we do have a really unique relationship with North Dakota. It's our only state of our states that we have this unique relationship, and it's actually why it's one of my favorites. The participants of North Dakota, because of our relationship, get to talk with North Dakotans. That is very important when they call to make sure that they are feeling like they're welcomed and they're known. I think that is really valuable. So a little bit about National Jewish Health. We are located out of Denver, Colorado. We were founded in 1899, and we are the top respiratory hospital in the nation. We were founded at the height of the tuberculosis crisis. Really interesting to work for them. Not that I worked there during the tuberculosis crisis, obviously, but it's been really interesting to work there at the height of the COVID crisis. So really very interesting. Respiratory science and health is always our forefront. We operate quitline services in 23 states. North Dakota, again, is one of my personal favorites, but we're a pretty robust operating system. And in March of 2020, we executed all of our coaches, all of our staff to work at home models, and have kept that in place since then for the health and safety of all of our coaches and staff. So we all work remote, and we're able to basically deploy an entire call center of around 75 coaches and about 20 management staff to work at home facilities without any blips on the radar with the calls coming into the call center. So we're really proud of that. The quit line started at the hospital in 2002. We are the largest nonprofit provider of tobacco cessation services. So any quote unquote revenue that we pull into the department is then reinvested into respiratory research, tobacco research, cessation research, so that we can become and remain the leading edge, I guess, knowledge base of respiratory health. We've helped more than 1.5 million people in quit attempts since 2002. And again, we're really proud of that, with one of the highest quit rates across the nation that we can report. So they're very excited about that. I want to talk a little bit about our staff. As I mentioned, we have just slightly over 100 staff members within our department. So we are a department of the hospital. And most of those are made up of our tobacco cessation coaches and CCRs. We have that unique collaborative partnership with UND coaching staff, and we partner with them to make sure that they are supported in whatever they may need to service the participants that are calling in to ND quits. We are also overseen by a clinical director and a medical director who are on staff and available to coaches at any point during the day. Our program features are, there's telephone coaching, we also have a digital platform, educational materials, and we offer cessation medications to anybody that's medically eligible and eligible through the ND quits line. Our suite of digital services sort of helps us kind of continue our reach and engagement of the participants as technologies emerge, or as people just really, quite frankly, don't want to pick up the phone. So we've tried to leverage some technology to support the quit program. A little bit about the process flow, and this is really where I want to spend some time because I want everybody to understand what happens when the participant calls in. So the participant will call in the 1-800-QUIT-NOW phone number, and they will get one of our CCRs or coaches here in Denver answering the phone. At that point, they will take some medical and demographic information and confirm eligibility for the program. Once they get through that portion of it, it's about a 7 to 10 minute call. They will then schedule with a North Dakota coach their first coaching session. So that whole process is then they are explained the program, they talk about what they can expect next, and then we have direct scheduling ability into the North Dakota coaches' calendars, and we schedule the next call for the participant. At that point, the North Dakota coaches take over, and they do a very great service to the participants because it is a dedicated coaching model and it is not a limited number of calls. It's really important to people that are attempting to quit using nicotine products that they really just have somebody that they can really build a rapport with, have an understanding with, and work through all the challenges of a quit journey. What's really important and unique in North Dakota is they have structured coaching calls, and the calls are structured, and they use cognitive behavioral therapy and motivational interviewing, and they build the rapport with these participants, but they're not timed calls. They do not sit there and say, okay, well, your 10 minutes is up, I got to get to my next call. They're appointments, they're flexible, and they're really relaxed. Again, providing that welcoming environment to each one of the North Dakota participants that calls in. So they move them into the enrollment process and the coaching process. They will assess the NRT eligibility and the medical eligibility if they need a doctor's note at that point. So if they are deemed medically needing a doctor's permission to prescribe NRT, the North Dakota coaches work with the participants to obtain that. The only participants at this point that are required an MD consent are if they are pregnant, breastfeeding, or if they've been told by a doctor that they shouldn't be using NRT. At that point, we would then again, the North Dakota coaches would work with the participant and the doctor to obtain that consent. Once the NRT consent is received if needed, or once it comes to that point in the coaching call, the North Dakota coaches will order the NRT, and it will ship directly to the participant's home. This was in place long before COVID, but we're certainly not sending anybody to pharmacies to get their NRT. It ships directly to their home within about 5 to 7 business days from when they've ordered it. So it's relatively quick turnaround, and it's really just the shipping time that lags. Once the order is placed in our system, it ships out within 24 hours of being placed. And then typically what we do during the intake call is we ask if the participants would be okay with a follow-up call. We note that. And then the evaluator of the program, which is PDA, then does follow-up calls 6 to 7 months after their intake to obtain quit rates, satisfaction rates, and the whole kit and caboodle of what you want to review in a program like this. I mentioned a little bit about our digital services. Again, the telephone coaching is really our bread and butter, and that's really where we get the highest quit rates. But what we also provide are some supplemental digital services to help the quit journey along. We have a mobile-friendly website in both English and Spanish that has several, it's loaded with information about a quit journey, but it also highlights different priority populations that might be reading the website in order to kind of see if they have a home or if they're feeling welcomed at the quit line. These priority populations groups such as LGBTQ community, pregnant postpartum women, American Indian, African American, Hispanic, Latino, they all have different sections of the website that support their community and understanding that they are welcomed and known at the quit line in that sort of manner. We also have interactive online resources. There's some quit calculators and some forums online. At any point, a participant can sign up for text or email support. This is usually a text or email library that is tailored to their demographic questions that they answered in the intake process. And they will get motivational texts or emails a couple times a week throughout their quit journey. They can opt out of that at any time. I don't want you to think that we're stalking people in text going to their phones, but that is another way that they can have some additional support. And then there's also chat online for general inquiry questions. So when they go to the website, a chat box will pop up and they can ask questions anywhere from, I don't remember when my appointment is, to I ordered an RT, I haven't received it, and have immediate 24/7 help online with some general questions about the program. As I mentioned, we do provide educational materials to each participant that calls in. These educational materials are tailored to how they answer the demographic question. So if they state that they have high blood pressure or COPD, if they state they are African American or they are part of LGBTQ communities, we put tailored messaging into these packets as another step to make them feel that they are truly welcomed and understood for who they are at the quit line. It is such an important part of this journey and an important part of supporting their quit journey. Just a little example of what these look like. Again, they are tailored to how they answer the questions. If they say that they use smokeless tobacco, they'll receive information about smokeless tobacco. If they say they are using e-cigarettes or vaping, they will receive information on that as well in their welcome packet. A little bit about program eligibility. North Dakota resident is pretty much the eligibility criteria for the North Dakota ND Quits program. Again, it is a dedicated coaching program through the University of North Dakota coaching staff. We partner with them. We try and support them as best we can and talk to them actually quite frequently on ways that we can either improve our support or continue our support. It offers an unlimited number of coaching calls. There's not a limit on the coaching calls. Again, it just builds that rapport and builds the support for each one of these quit attempts. There are special programs offered through ND Quits that are supported by the NJH staff, and I'll go into those in a little bit. And again, NRT is available for those that are medically eligible and over the age of 18. Even with a doctor's note, we will not prescribe NRT to anybody under 18. That's just sort of our stance on that. As I mentioned, the NRT is shipped directly to the participant's home. We know that coaching plus NRT is really the best shot at becoming quit and staying quit. So we really encourage that across the board. And North Dakotans are eligible for up to 8 weeks of NRT, and it's available for most participants. Just a couple fun facts I put together for the North Dakota ND Quits program when I put this together. In FY21, so July 2020 through June 2021, there was over 1,000 phone intakes completed and over 3,000 coaching calls completed in that year by the ND coaches and by some of our staff. In that same year, we had over 950 e-referrals, 140 fax referrals, and 90 referrals, web referrals came into the quit line. So that's the referral process, making sure that we can reach these participants. So far in FY22, We have completed 600 phone intakes and over 2,000 coaching calls. I think that's a really impressive stat for the UND coaches to know that just this year they've completed over 2,000 coaching calls, as well as over 500 e-referrals, over 90 fax referrals came in, and over 20 web referrals came in for the Quit line. So really great usage of the END Quits program. I'm going to now just break into a few of the priority programs that we offer through NJH. In this instance, if they are eligible for one of these programs, the coaching is actually done by our coaching staff here in Denver. But most of the coaching is done through the UND coaches for the general program. So just wanted to make that difference. The first one is our American Indian Commercial Tobacco Program. This program started, I believe, in 2014, and we often refer to it as the AICTP program. That's usually what rattles off my lips. It's a dedicated toll-free phone number, as well as a dedicated website for this program. This is for anybody in the American Indian community that wants to quit smoking. And what we really built this program on is understanding the tribal versus commercial use of the tobacco, and respecting that there's tribal uses of tobacco versus the commercial use of tobacco. All of our coaches for this program are American Indian. That is sort of one of the requirements to become an American Indian coach. And it is a 10 coaching call program. What we've discovered is that it is a longer program. So unlike the UND program, our general program does have call limits. So the American Indian program is expanded to 10 coaching calls. I say that, but additionally, our program supports unlimited inbound support calls. So these are 10 proactive calls that we will be making to each participant that's in the American Indian program. Up to 8 weeks of NRT is offered. We have around a 38% quit rate in this program, which is pretty good, and we're really proud of that quit rate. And they really like the program. The participants in this program have reported back that they really like how tailored the program is, how welcoming the coaches are. And we have recently hired 3 new coaches. And I believe one is out of North Dakota. I will confirm that, but that's what I heard in a meeting the other day. So that's even cooler. So again, they are all tribal coaches. They're all from different tribes around the country, quite frankly. And it is a very I don't know how to say, supportive program for this community and for this population. We also offer a pregnant postpartum program. This program was started in 2010 and is now being offered to almost all of our 23 state clients. This is a 9 coaching call program. 5 coaching calls during pregnancy, 4 coaching calls postpartum. These coaching calls are incentivized with the support of North Dakota. So they are incentivized for $20 for each pregnancy call completed and $30 for each postpartum call completed. The participants will get a card mailed directly to them that then obviously holds those incentives for them. It's a tailored text message and email program throughout the program and throughout their quit. Just because they may quit or complete the program, the text and the emails continue for additional support, again, until they opt out of that feature, if you will. This is a dedicated female quit line coach program. All of our pregnancy postpartum coaches are female. Again, that's one of those non-negotiable items for us. And it really, because it's a dedicated coach, much like the UND coaching model, there's the ability to build a deep rapport with the pregnant postpartum women. There's some major trust and concerns of judgment in this population. And so we found that this was really the model that worked for this program. 68% of the women that completed 3 or more calls during pregnancy and 3 or more calls during postpartum have remained quit at their follow-up, their 6 to 7 month follow-up. That is something we're really proud of when we did a deep evaluation of the program. Again, NRT is available through this program, but with a doctor's note. So we have to make sure that the doctors are approving NRT if they're pregnant or breastfeeding. Our youth program. This launched in July of 2019. My Life, My Quit. This program, we're very proud of all our programs, but I'm personally, it's one of my favorites because I was part of the launch. So that's probably, I'm a little biased, right? This launched at the height of the vaping epidemic in 2019. We started planning it in 2018. To date, we have 22 states in the youth program. We have one that is not in the youth program. And it was really formed by youth and for youth. Even the name itself was decided through youth focus groups. And that was the name that won. We held a little contest. It is a dedicated toll-free number or a short code to text. This is our only program currently that we have the ability to text with a coach, and it is a live text interaction. It is not a text library, though I'll get to that in a minute. They text, there's about 4 questions to confirm eligibility, and then they are talking with a live coach, and the coaching is all done via text. So they have several ways that they can get to us through the program. They can certainly call, if they call 1-800-QUIT now and they say they're under 18, they'll be moved to the My Life, My Quit program and with a youth coach pretty quickly. They can call the dedicated youth number. They can text the short code, or they can chat with us online at mylifemyquit.com. This program offers phone, web, or a combination of both phone and web protocols for anybody under 18. It's a 5 coaching sessions by, again, phone, text, or chat with a youth specialist. Not all of our coaches are youth specialists, so it is a kind of rigorous quality check to become a youth specialist. They have to make sure that their rapport, not only over the phone, but certainly over the text and the chat process, is that's going to resonate with youth. So we have about 15 youth coaches. There is an additional tailored automated text and email library that come with this program. So again, there's always the live coaching available. And additionally, they can sign up to get supplemental text and emails that, again, were designed by youth and for youth in order to help support their quit. It's a simpler registration and intake process because we are not prescribing NRT. There is no medical demographic questions, and there are no insurance questions or any of those kind of other big questions that really are more applicable to the adults. It's a very quick registration and intake process, and then they move directly into coaching. All of the educational materials that they receive were designed by them in focus groups, several focus groups. And in October 2020, we revamped the website. So we had feedback from the rescue agency as well as some additional focus groups. We revamped the whole website to be really youth focused. When we revamped the website, we created what essentially what I'm learning now in my fancy web lingo is splash pages. So when you go to the mylifemyquit.com website from North Dakota, it pulls your IP address and it drops you into the North Dakota website. That means you don't have to select your state. You don't have to do a lot of searching around when you're enrolling. It automatically knows you're from North Dakota. If for some reason it pulls a neighboring state, it will say, are you not in this state? Click here. And when you click there, then you'll still have the option to choose the North Dakota site. So it's pretty fancy. The splash page is pretty fancy in my vision. We also did additional focus groups and additional follow-up and evaluations of the program. We were really proud of the youth program and excited to continue to share that youth program with you guys. I always feel like that's fast and furious. So if you have any questions, please don't be afraid to ask. I wanted to leave enough time for questions or comments or concerns or anything like that.
Katie, there was one in the comments, a question, or in the conversation, and it asks if it's possible to get a copy of the print materials that Quitline participants receive.
Yeah.
Karen had indicated that the book was copyrighted, but they weren't sure if that was able to be shared with them so they could see that.
So the book is copyrighted for National Jewish Health. Are you asking because you want to hand them out or just sort of see what the materials look like? Is there a chat? Oh.
I'd be interested in just seeing what they're getting. You know, when we're pitching program and stuff like that, it'd be great to know a lot more. I mean, this has helped. This has been a great presentation, but having the materials would be nice to know more about it too.
Yeah, I can let me see what I can pull together.
Thank you.
You're very welcome. It looks like, sorry, I didn't have the chat box open, so I apologize for not seeing those earlier. So I'll just run through it. So I'll look through the My Quit Journey book and see what we can share, or if I can, just send you a copy of it or something. I can definitely look into that. Do we see a future of NRT being available for youth and vaping? It is a hot topic right now. Definitely a one that we had a pretty strong stance on, and with more studies and more FDA findings coming out, it is being considered, but I've only heard the official responses, not right now, and probably not. There's not enough evidence. I mean, obviously we know what the nicotine's doing to their brain development, but we don't know there's not enough evidence from what I understand of what the NRT is doing to their brain development at such a young age, under 18. So we don't know. I don't know, but I'm sure it will be heavily considered.
Yeah, those were the only two questions I saw in the chat. Do feel free if you have any more to add them in or to come off mute and ask away. Katie does need to step away, so now's your chance to address your questions to her. If any questions do come in after she does have to disconnect, we will be sure and share those with her and get you an answer. But please do.
I do have a quick one, Abby.
Go ahead, Ray.
Relating to My Life, My Quit, is there a plan for there to be any more promotional materials available for that, or is that going to stay print on our own?
Really great question, actually. So I'm excited to share that probably here within the next 2 to 3 weeks, we will have some more promotional materials on the website itself. So under mylifemyquit.com, there's a resource tab that has some print materials right now. We've done some new marketing materials, and we'll get those put on the site. Last I heard yesterday was like between 2 to 3 weeks. And then I think that there's everything else does kind of work from the state inward, if you will. But we do have those free materials on the website.
Thank you.
Sue, it looked like you had your hand up.
Yes, I do. Will we get a copy of these slides?
Yeah, I can send that. That's no problem.
Thank you.
Yeah.
Great. And it also looks like there's a question. How many times can people re-enroll in the program?
So the NRT eligibility, it's a twofold thing, right? So the NRT eligibility is reset. So it's 6 months from the day of the first shipment. So let's say they ordered it in March, then they would be eligible for more NRT in September. So that is kind of one layer of it. And if I'm not mistaken, and I apologize, sometimes I get a little fuzzy on some of the different states' regulations. There, you can enroll in coaching as many times as you need. If it goes 90 days, so if I have my last coaching call here, and then in September I want to re-enroll because it's been more than 90 days, we do re-ask the demographic and medical eligibility questions to be sure that those are accurate. So they will have to kind of go through that intake process again, but they're welcome to re-enroll.
Bev, you had a question?
Yes, thanks. I'm just wondering, sometimes, you know, when we make these referrals, or a lot of times when we make the referrals, I wonder what happens to them. You know, do they, are they successful, or do they drop off, or, you know, I just wonder sometimes when I make those referrals, what happens to the client? Is there any kind of feedback that we can get, saying, you know, they've finished the program or they just aren't responding? I often wonder.
Yeah, so that's a really great question. So if the referring party is a HIPAA covered entity and you mark that you are a HIPAA covered entity when you refer, there is some sort of feedback report that goes, and it's what we call event based. So when they enroll in the program, when they complete the program, when they've ordered quit medications, or if they've become, to your point, unreachable, we can't reach them. If it is not a HIPAA covered entity, unfortunately, all you will get back is, yep, we've got your referral. And that's just, we can't get around that HIPAA protection. Does that help?
Yes, thanks.
Yeah.
Any other questions for Katie? Seeing none, I would thank you very much for your time today sharing with us. And if any questions do arise, please do put them in the chat and we will get those answers for you. So thank you very much, Katie.
All right. Thank you guys. Have a wonderful day.
Very good. We will move on now. We've brought in two of our UND counselors. We have Elizabeth and Becky here with us, and I will turn it over to them to kind of give a little overview of what they do with their clients when they're coming through the line. And if you have any questions, you can put those in the chat or hold those until they give their brief introduction.
Hi, my name is Elizabeth. I've been a coach with ND Quits since 2009, so a number of years. And to start with, a lot of people wonder, you know, what we're seeing when we get the participants. So we see all of that information that Katie mentioned that they do in the intake. So we'll see if a participant is smoking or vaping or chewing. So we always like to make sure to, you know, address that. So if they're smoking, you know, one of the first questions we'll ask is, what's motivating you to quit smoking at this time, or vaping or chewing, and then kind of go from there. And that's really how I like to begin the call. So that way we get a little bit of an idea of what brought them to our program. So that definitely informs where the call goes from there. If someone is quitting because they've been told they have to quit by their doctor to get a surgery, often they have a little bit of a different feeling about the process than someone who's you know, calling in or has quit before. We always ask, you know, about their quit history. So if they've used any of the nicotine replacement or other medications, to get an idea of what they've already tried and how it went for them. So you can also see all of the previous quit attempts. So if they've ever used our program before, we can see a little bit about that history as well, if they've used certain medications, and we ask about that and just kind of address that. I know people are often very concerned about, you know, if or when they're getting that nicotine replacement. So usually like to address that pretty early on in the call, and then start exploring their triggers, what they see as their biggest challenges to quitting, and then just really go from there. We place that nicotine replacement order if they're eligible during that first call, and then we're going to schedule the follow-up call usually in the next week or two, so that way we're reaching them as they've gotten a chance to start on their quit date and start using that nicotine replacement.
Hi, my name is Becky. I've been with the Quit Line for 8 years now, just coming up in April, so quite a while as well. So yeah, like Elizabeth kind of touched, you know, we go over the medication history and all that, and then we'll kind of move that process on to then what challenges they kind of see to quitting. So many people don't realize when they start their quits, you know, that you've really got to think about it ahead of time. If you just kind of pick a day and just get started without having a plan in place, there's going to be a lot of roadblocks that occur. And so really just asking people, you know, what's your routine with smoking and making them aware, because it's usually pretty routine, you know, in the mornings, after coffee, after lunch, driving. And so once they start rattling off all those things, they kind of start to realize, oh yeah, what am I going to do when I'm in the car driving? Or, you know, oh man, coffee is a challenge for me. So then kind of based on those challenges, we then ask, okay, so what are some things you could do to change up those routines, alternative coping skills to smoking. It's really important to have a good set of tools to kind of find alternative ways to cope, especially when it comes to stress. Stress is probably the #1 reason that people relapse. And so I spend a lot, I think we all do, we spend a lot of time with people discussing relapse, or excuse me, stress coping skills and other ways to manage that in a more healthy way versus smoking, because we just try and get them to realize, you know, stress is something that's never going to go away. It's just a part of life, and so always got to be prepared for that. And you know, what other things, you know, taking a walk, or, you know, listening to some music, calling a friend or family member, just and getting those ideas. So many people just really aren't sure when they call in, you know, they've tried a few things, but they're kind of out of ideas. And so you just kind of, you know, rattle off a few things. I try not to overwhelm people, you know, because there's obviously hundreds of things you could do, but just a few things. And I kind of then will determine, you know, is that something that is feasible for you and, you know, your daily routines? If not, we might brainstorm a few other things. We always like to try and include them. I always tell people, you know, this is your quit. You know you best. This is, you know, your routines and what's going to work for you. What has worked for someone else, it might not work for you. So you've got to tell me what's, you know, what you think will work, and then I'm going to help guide the process. But in terms of telling you how to quit, I can't do that. I'm not here to instruct you like you have to do this, that, and so forth. So really trying to involve them in this process so that they're taking control of it. And I'm just kind of here to be an additional support to them and kind of, you know, bounce ideas off of. And I like to tell people, you know, some people will get frustrated, and I tell people, you know, this is kind of like a big experiment. You've got to have a few things that you try, and maybe that first time it's not going to work, and then you reach for a new idea, and then you incorporate that, and eventually you're going to find something that sticks and works for you. So, but it can take some patience, and really letting people know this is a process that you've got to stay positive in, and you've got to have patience. Because if I tell people, you know, you've smoked for how many years? That doesn't just go away overnight or within a couple weeks. A big question we always get is, you know, how long is this going to take me before I don't feel the cravings anymore, or I don't feel like smoking anymore? And that's so unique on each individual, but it's a process. It's like any other addiction. So
yeah, I think that's a really good point. A lot of people are doing well with their quit during their follow-up calls. Maybe they've been smoke-free for, you know, a few weeks or several weeks, and they still have thoughts about smoking or chewing or vaping. And sometimes they can get a little bit discouraged because they feel like, you know, I'm doing well, I'm doing what I'm supposed to, I'm using my coping skills. Why is this still happening? And it is really important to remind them that, you know, even after they've gotten over the physical withdrawal, all of that behavior takes, you know, maybe up to a few months to really go away and to feel like this new routine is normal for you. So just because you're having those thoughts doesn't mean that you're not doing well with your quit or you're not using your tools. So definitely want to normalize that through the follow-up process. And just in terms of follow-up calls, how those go really just depend on what's going on with the participant. You know, some people are doing well and they're kind of short check-in appointments. Some people are struggling and still using tobacco. And so we'll continue to work with them, finding new coping skills, maybe making some adjustments with the nicotine replacement and how they're using it to make sure they're using it correctly and that it's a good fit for them. And so it's always my goal throughout the process that they feel like they're getting support and they're getting a benefit out of these calls so that they'll pick up with the next call, because it's very hard to continue to work with people through this process if they feel like they're not going to pick up the phone call. So definitely want to make them feel like they're not being judged at all if they're having slips or lapses, and that they know that this is a really ongoing supportive process. And like Becky said, just an additional resource for them to bring our specialized knowledge to them and to be there for support or accountability or, whatever kind of partner they need in this process.
Yeah,
there was a question on combination NRT. Do you start that right away? Or maybe if you could speak just in general, if participants are able to get combo therapy when they call into the quit line?
Yeah, I can answer that question. Most people, yeah, I would say are eligible for combination therapy. It's actually really highly recommended. That we do a lot of training at the Mayo Clinic, and they always push combo if a person is willing to try that or has the means. So yeah, a lot of people will go with like a patch and gum or a patch and lozenge, and we'll just kind of dose that accordingly to how much they're smoking. So
yeah, especially if they've tried monotherapy and failed, or if they're smoking over a pack a day or chewing, that equivalent amount of nicotine or vaping. I saw a question in the chat that was, how do we dose people who are vaping? And that is difficult, I think.
yeah.
Whenever we've gone to different conferences, I think a lot of people have questions about that, and there's some information out there about some of the most common brands. Often I will ask them, what device are you using? What brand is it? And I will try to look that brand up online and see, what they have as far as that. So it's just kind of trying to find our best estimate of how much nicotine they're getting. And then just as I would with traditional cigarettes or tobacco, chewing tobacco, I would try to match that with the nicotine replacement as best we can. So it's not a perfect system. Sometimes if they were previously using smokeless tobacco or smoking, I can ask, how much of that were you using? And when you switched to vaping, did you feel a lot of withdrawal, or did you feel that you were still getting about the same amount of nicotine? And then maybe also that will inform how much nicotine replacement they're getting. But it's difficult with how many products there are out there, and they're not, well regulated. So it can be just kind of giving your best estimate. And then once they start it, seeing how they're doing. Are they going through a lot of physical withdrawal, or do they feel pretty satisfied with the amount of nicotine they're getting?
There was also a question on Chantix or inhalers. Kara, do you want to step in?
I would just say that IndyQuits provides the nicotine gum, nicotine patch, nicotine lozenge. So if someone is interested in Chantix inhaler or bupropion or the nicotine spray, those are prescription and you'll need to see a provider.
And so on our end, usually what that looks like is we go through our first call, get to know them, talk about their quit plan, and then we usually schedule a follow-up call once they've had a chance to talk to their doctor and see, did they end up getting that prescription, and then schedule our follow-ups based on their quit date from there. Or if, they're not able to get that prescription, see if they want to revisit the nicotine replacement options at that time. I think I saw a question about when people miss the first call. So when we see a participant that we're going to call, basically they show up in our schedule as an appointment time. So we will call them. I try to call right at that appointment time so they know it's us calling and not a telemarketer or someone else. And I always encourage people to program our number in so they know it's us calling. They don't, screen that or miss that call. And if they miss the call, we will leave a message if we're allowed to. Most people allow us to leave messages, so they can always call us back and reschedule. And especially once they have spoken with us, once they have that dedicated coach, they know they can call in and press our option and leave us a voicemail. I really encourage, if someone's missed a call, to call in. Typically, if someone hasn't received any calls, if they did the intake and they didn't get put into our schedule, because we call everyone that's in our schedule. And then if they've missed a call, we call them 2 additional times about a week apart. So we do reach out to them several times in order to try to reach them and either reschedule or complete that missed call. So if they're not getting calls, I definitely encourage them to call in, because either something happened and they didn't get put in our schedule, or if they've changed their phone number and maybe forgot to give us the phone number, or their phone's been out of service, or their voicemail's been full and we haven't left a message. But we do call everyone. So if they're not getting a call, there's something that's happening in there, and just encourage them to call in, make sure they've got the right phone number down. And if they have a voicemail that's full, I usually leave that in the notes so someone can see, oh yes, they called on these dates, but your voicemail was full and they weren't able to leave a message.
Elizabeth, is that every call? Because I can kind of remember this coming up before. Someone misses their call, and I think it might have been Josh that, I don't know, I felt like if they missed their appointment, it'd be like any other appointment, like your dentist appointment, you forgot, then you need to call and reschedule.
Absolutely.
That's what happens, or what?
Yeah, that's a really great thing if they want to call and reschedule, because we will call them a few more times, but it's a few days apart. So if they miss it by a few minutes and they call in, often we're still able to have time and do that call, or, we can get them rescheduled more quickly. So yeah, it's, their appointments. And so it's really important to just encourage them to keep calling in if they're missing a call. Usually there's always a good reason for why they're not getting those calls. It's not that they, we just didn't feel like calling them that day or something.
I do see Bev's question in there about what caller ID says, and that can be very dependent on your service provider, knowing that a lot of people use cell phones. There are differences between AT&T and Verizon. So I do believe one of the carriers does say ND quits, but more often than not, it's going to be the 1866 number. I don't know off the top of my head, but the last 4 digits actually spell quit if you were going to figure it out. So it's always, I do try to share that with new TTS, or I can share that email again, that there is the 866 phone number that you could use and help your participants, patients, clients program that in so they would recognize the incoming call. Just like when Elizabeth and Becky said, they do tell them to hopefully set it so they know who's calling. So it's dependent on the provider usually.
Yeah, and when we leave that message, we leave that number. It's 866-388-7848. So that's always the number we leave. And whenever I'm working with participants, that's usually what's showing up on their caller ID. So then they can program that into their phone.
Is that the intake number that National Jewish Health uses as well, or no?
You would use the 1-800-QUIT-NOW, or there's a North Dakota specific one. But that's the number you call into. It's a different.
And when people call in, they'll get, a greeting, and then it will say, press 1 for English. I think it's just press 2 for Spanish. And then once you press 1 for English, it will go to, are you a returning caller? Are you calling back your coach, or are you not currently working with a coach? So if they need to do that intake, they would go, not currently working with the coach. If they have a dedicated coach and they press 1, then it will go through our list of names. So for example, it will say, are you trying to reach Elizabeth? Press 1. And then it goes through to my voicemail. So that way, once they have a dedicated coach, they can more easily leave a voicemail for that coach. So it's easier to return that. And then, if I'm in the office and I'm available, I get a little beep in my headset. And so then I can take that call if I'm available, or I can wait for the voicemail and return that once I'm off of a call.
I see Beverly added an additional comment that many people don't answer thinking it's spam. And that's definitely been a struggle we've noticed the last couple of years, especially with the robocalls really increasing. That's why we just really encourage people to have, program that number and more importantly, why we call at that exact specific time that we tell the person. We're never trying not to be a minute late or a minute early, so that they are aware of that. Encouraging, if people want to write their appointment times down, just so they remember. But if they have a voicemail, we'll always leave a voicemail. I think the biggest roadblock is if they don't answer and they don't have a voicemail set up. That's where it's kind of just on them to hopefully see that missed call and call back.
And I think if they've signed up for text messaging, they also get some automated text reminders. So that's also helpful. So it can remind them your coach is calling tomorrow. So that way they know they're kind of expecting that call.
Yeah, that's been a good addition to things. I have a lot of people tell me like, oh, yep, I got the text yesterday, so I was waiting for your call.
I don't see any other questions right now in the chat. Thank you both for your time and experience, and we appreciate that. Any other questions for our two counselors who joined us today? Well, thank you both. If we receive any questions after the fact, we will, of course, same thing, pass them along to you and get answers. Our final presenter today is our good friend from Tobacco Free North Dakota, Heather Austin. She's going to go over her AAR presentation that she presents across the state to different medical offices, so you kind of have an idea of that outreach. So, Heather.
Thanks, Abby, and thank you so much to this morning's speakers. I have learned a lot. You all are definitely the experts in this field. I'm just happy to do a small part in pushing people your way or helping other people push people your way, more specifically, I suppose. I'm going to share my screen, and I have just a few slides, but I am going to kind of give the caveat that a lot of the folks on the call this morning or on this meeting this morning probably already are using some of this, or you may have adapted some of this or have seen me present this in the past. And so just know that it's more a refresher for you in that case, but my hope is that we'll catch some new people that maybe aren't aware of us, giving this information out, or maybe haven't thought of it in this kind of method or activity just yet. And so maybe it will be helpful as you continue to serve clients in whatever capacity you're doing so. That all said, I'm going to share my screen, pull up these slides here, and see if we can't get this rolling. So if I go, oops, slideshow, here we go. Is that appearing as a slide? Here we go, from the beginning. Sorry, I feel like I just all of a sudden forgot how to use a computer.
It's good.
All right, here we go. So that being said, I have two slides I do at the beginning of every presentation. I have many friends on this morning, so you probably already know about me and about my organization. But for those of you who maybe don't, we are Tobacco Free North Dakota. We are an independent nonprofit. We are small but mighty. We have a 7-member board of directors with 4 members located all across the state, from Grand Forks to Ray to Dickinson, Bismarck. And so it's a great team of people providing insight and oversight for our organization. I am their executive director, and I do have one staff person. His name is Andrew Horn. On the screen, you can see he's on the very right of the picture, smiling with some of my board members, and our lobbyist from last session, Dennis, is also in that picture. And our mission is simply to improve and protect the public health of all North Dakotans by reducing the serious health and economic consequences of tobacco use, which remains our state's #1 preventable cause of disease and death. This is the second slide I always like to show whenever I'm presenting, just to give a little bit of background on why we do what we do. In North Dakota alone, 1,000 adults die every year from tobacco-attributed diseases or tobacco use illnesses. And a few years ago, my dad was one of those thousands. And so this work gets personal for me. And I really appreciate the opportunity to do this type of work across our state. Every year, 300 kids under 18 will become new daily addicted smokers. And a big piece of what TFND attempts to do is prevent that. And so to kind of put that in perspective, that adds up to around 14,000 kids who are now under 18, someday dying prematurely because of smoking. And that doesn't take into account vaping statistics that might be skewing those numbers now too. But this is more than the entire population of our local school system here in Bismarck. And so that's mind-boggling to me and heartbreaking at the same time. It's also very costly to our state. We know that North Dakota spends around $326 million every year on tobacco-related healthcare costs. This is also in addition to the lost productivity, which we estimate to be around an additional $230 million per year. So that's $500 million per year that tobacco is costing our state. And you can see from the small graph on the right that toll nationally adds up to more persons dying than many other causes combined. So AIDS, homicide, alcohol, suicide, obesity, tobacco outpaces them all. And so this is why I think our work is so important, and why having experts in the field, such as we do here in North Dakota, is hugely beneficial. So we know, this is the other slide I always talk about in every presentation, we know some of the best methods to reduce and prevent tobacco use is our three-legged stool of tobacco prevention policy. These are CDC recommended best practice policies that many of you, I'm sure, are aware of. But for those who are not, they comprise of having a very strong funded comprehensive tobacco prevention program. This is where some of our cessation resources in our ND quit line falls in. And so they are best practice recommended policy, having that quit line service and having the intake and counseling that we have set up all plays a part in that piece, that leg of the stool, so to speak. Having a strong indoor smoke-free air law, we can check mark that one off. North Dakota actually has one of the best in the nation. It's come under attack the last couple of legislative sessions, but so far we've been able to keep all the folks at bay who want to provide exemptions or exceptions to that law, and so it's still intact and very strong. And then having high tobacco taxes, that's a leg where we don't have a great track record in our state. We currently rank 49th in the nation for our tobacco taxes, and they haven't been raised since 1993. And so that's probably the weakest leg of the stool that we have. I know you see an X on our comprehensive program funding leg. That being in terms of being toward a recommended level, and so that's why it does technically have an X, even though it's not nearly as wobbly as our tax leg. And so if you ever have questions on policy or want other information on how we're combating policy across the state, you can reach out to us and we'd be happy to share that with you. We also have done a webinar previously on that that you can find on our website if you want more details on that, or if you missed it. So here's just a little bit of background and why we talk about what we talk about in terms of AAR, and I'll get to explaining what that exactly is in just a minute for those unfamiliar. But I think it's important to know that we have worked with kind of non-traditional healthcare provider populations to make them aware of this type of process. Primary care physicians and health systems that work in this field day in and day out really might have a more extensive process to referring people to cessation services. So what I present today is maybe meant for more of those non-traditional entities and organizations, or people that are new to offering this type of support to clients or patients, depending on what their organization is. But a few years back, so my data is a little older, but I think it still gives us some insight. A few years back, a survey was sent to all eligible healthcare providers in our state, and we had a response rate of just over 800, and just kind of as a subgroup, for instance, 155 of those 800 happened to be dentists. And so coming out of this, to give you a little bit of kind of background information, there was a pretty good percentage of respondents always or often asking their patients about tobacco use and advising their patients to quit. And this is where I think we have some opportunity to be able to provide more intake referrals for our quit line and for some of the resources that we have available in our state, because I believe that our quit line is one of the best in the nation, if not the best, and call me biased. biased, but I think that we have some good data to show based on what we've seen this morning, and it's backed up. But that being said, if you can see the bottom of the graphs here, we do really well with primary care physicians, OBGYNs, physician's assistants, nurse practitioners. We have really high scores with those types of offices and health systems asking about tobacco use and advising patients to quit. Where we have opportunity is where maybe there's some non-traditional entities providing health services or health-related services, knowing how to provide this as a service alongside everything else that they do. So dentists, chiropractors, other health related fields, or other entities that maybe dabble in this arena but don't do it full time the way a medical office would. And so that's why we give this information out, and why I sometimes will travel talking about this. Dental association partners and chiropractic offices are who typically express the most interest in having us give them this type of information. And so here's where the percentage of respondents, again, kind of bears out that same thing, although all the numbers are a little bit lower in this one, but it's percentage of respondents who reported always or often assessing their patients' willingness to quit and assisting patients in quitting or seeking help quitting. And so this can be maybe enhanced through, more extensive intake questioning, maybe through motivational interviewing, or spending those few extra minutes of just talking through a little bit more to draw out what the patient's needs might be. And so that's another area of opportunity that we talk about when we're presenting to organizations interested in this type of thing, is we'll give them some tips and resources on how to incorporate more of that into their intake process, in the hopes that it leads to better information coming from the client or patient, so that they know how to better refer them or provide resources to them. And just to back up, you can see the high 70s is where our more medically related healthcare fields fall, but then it really drops down for those more non-traditional healthcare fields. Or no, I shouldn't say non-traditional. They're traditional. They're just non-hospital or non-medical in terms of what they're doing. So the four most common ways that we found enrollees hearing about ND quits were through, and our kind of data bears this out, but through their doctor, their nurse, or other healthcare provider, television commercial ads, having and so you can see by far and away what's happening when you're talking to patients and clients in a health related field is very important, and it's very successful. 40% of all of those referrals coming from that interaction is very beneficial. So here's where we get into what it is I'm talking about for those of you unfamiliar with it. So the 5 A's, or more specifically in our case, we'll talk a little bit more about AAR. And these are guidelines that we use to address tobacco use with patients or clients. So the 5 A's are ask, advise, assess, assist, and arrange. It's a bit of a tongue twister. We really request that people don't just ask about one type of tobacco or use the term tobacco when talking about that or asking about that. I think it's very helpful and beneficial to list out multiple forms of it. And I'm so happy to hear our experts this morning doing just that. So when you're asking someone, do you use tobacco products, it's good if you can ask, do you use tobacco, cigarettes, chew, vaping, Juul? I mean, give them examples of what it is you're the state, that not everybody sees tobacco as tobacco as tobacco. They have a harder time connecting, especially some of those electronic products, to being the same as traditional commercial tobacco that we know in form of cigarettes and chewing tobacco. And so helping them connect those dots to really draw out what products they're using is hugely important in our opinion. The second one is advising them to quit. And it can be as simple as, a statement, well, have you thought about quitting? Do you think quitting would be a benefit, to some of the health issues that you've been experiencing? And try and draw some of that out. Assessing their willingness to make that quit attempt is a part of that conversation. and how you go about advising that quit or asking for that quit. And so maybe that motivational interviewing process, I know some of you might have had training on that in the past, and that's something we can also provide information about for those interested that haven't had that type of training, but that will help with the assessment and getting them to that place where they are willing to make a quit attempt, and then assisting in aiding the patient into quitting by providing the counseling. If you're a tobacco treatment specialist, maybe you do some of that right then and there. If you aren't, that's where getting them, into the Quit Line program, ND Quits program, or My Life My Quit, or I'll have an announcement at the end here for another option that might be relevant and potentially helpful for you, but really helping them know what steps to take to get into those services is really key. Handing off a brochure or a phone number to call isn't always the best option. Sometimes they need a little bit more hand-holding than that, and you might have to show them several different methods of them to connect to what they need in terms of cessation services, and then arranging a follow-up or ensuring a follow-up contact. So this is the overarching, more intensive version of helping people access quit services. So these are most often implemented in settings that provide inpatient services, or when the provider is directly facilitating the quit plan from beginning to end. Not everybody has those capabilities, and so we also talk a lot about the ask, advise, refer, and this is a more simplified version of the same thing, the same process. It's simply to ask about their tobacco use, advise them to quit in a non-confrontational and non-judgmental way if possible, and then refer them to the cessation resources for support, either in-house if that might be applicable, or in many cases it's more applicable for them to be referred directly to the ND Quits. So this is best implemented in settings where the patient might not receive in-house counseling or cessation assistance, or if you just don't have that capability to use anything other than an outside service like ND Quits. Here's an example of what that might look like. This is a sample form that we had gotten from someone through an office in terms of what they were collecting for intake information for a client. And so this can be adapted or tweaked depending on what the organization needs and what other information they're maybe already collecting in terms of health related information. And so this is just an example of how you can kind of track what they're hearing from you and what they're receiving from you based on the information that they give you. So they might tell you, if they're a current everyday smoker, they might tell you the types of products that they're using. And on this particular form, you see it listed out as cigarettes, cigars, smokeless, e-cigarettes. Some organizations will even go so far as to add specific brands or specific types of vaping on there now that we've seen, disposables like puff bars and Juuls and things like that come onto the market. And then, what they're being counseled for, if you counsel them to quit or to cut back, if you are referring them outside of your office, if you are referring them, what type of referral are you giving them? Are you helping them contact their primary care physician? Are you giving them brochures or information on ND Quits? Are you helping them fax in directly with their referral? Are you doing something else like getting on the website or helping set up the first intake phone call? And then if they have any secondhand smoke exposure, that would play a role in this. And so this is just one example of what a form could look like and how we talk to people on how to set up their intake information or to get health related information. And here's kind of the ultimate of why we do all of this. It is efficient. It can happen in 90 seconds or less. It doesn't have to be a long, arduous process. I know sometimes time is at a premium in offices and in health settings, but it can be as simple as, do you use tobacco in any form? What I mean by that is, do you smoke, chew, vape, use e-cigs, have a Juul, anything like that? If the patient says no, you're done and you thank them. If the patient says yes, then you can follow up and say, well, have you ever thought about or tried quitting? This is where some of that motivational interviewing might come into play. Has your use of these products affected you in any negative way that you would want to maybe address or take a look at how to not have that negative influence on your health? And then you can use that to connect the dots for them to see why it might be important for them to quit and kind of get that thought percolating in their minds. And then once you've had that conversation or said those few sentences, you can let them know that there's free assistance through ND Quits, and then we can send that information home with you. And I just noticed a typo in here. There's a space for ND Quits. That is not correct. We know it's all one word. So I apologize, and I will get that corrected for the next time we do this presentation. But yeah, ND Quits is all one word. And so you can make sure that they're getting that information sent home with them, or helping them connect with that information right then and there. And like I said, this can take 90 seconds unless the patient or client has a lot of questions or wants to have more conversation, but it doesn't have to be an arduous process. And then we know it's affected. It's a high yield policy. Studies have shown that healthcare providers are the best, most efficient messengers in delivering quit messaging. It's far better than mass media, advertising, family, friends, employers. When making a decision to quit on your own with no support, the success rate is rather small. That cold turkey is difficult for most. When you have a health provider's advisement, or when you have limited support or a recommendation, it increases pretty substantially to 8 to 12% success rate. When you have the quit made and using ND Quits and having a combination of counseling and NRT, like was talked about earlier, that 30% success rate is vastly superior to any other method. Why do we care so much about this, and why do we talk about it like this? Well, healthcare professionals see firsthand, up close and personal passive tobacco use. You see the negative effects. You see of tobacco, and preventing young people from starting tobacco does have a significant impact on many other health outcomes. We go so far as to say is almost all other health outcomes, just because of how tobacco affects so many different systems within the body. And assessing it is a vital sign, and implementing the public health lines have lasting effects on overall patient care. And that's the goal of most healthcare professionals, no matter what their field is. You're in the business to make people healthier and to make them feel better. And so this can be a small piece of that process. And time again, it's showing that healthcare professionals are being identified as the best messengers. People know you and trust you. They're coming to you for other needs and advice. And this should be no different, in our opinion. So we promote this evidence-based policy, but ultimately we need your help. We're a nonprofit organization. We don't work as boots on the ground in the medical field. And so we hope that your patients expect you to talk to them and care for them, and that discussing tobacco use should be no exception to that, and referring them to resources is a great way to do that. So we hope that we can count on you, and this is how we frame it when we're out promoting this across the state, and how you could frame it if you ever want to use this presentation or this information. These slides are free for you to take and use. I'll make sure Abby has them after I correct the space between ND Quits. So that you can have that too. A few direct links that also might be beneficial as you talk about AAR yourself, or the 5 A's, or as you work to implement them if you aren't using them, or work to share information for others that might want to implement them. There are many brochures available. And I'll pull up the 2 sites after I close this PowerPoint and show you what they are. But one is to get ND Quits brochures for your office. So if you want to order those, there's a website that you can directly do that on. And then the other is if you want a form for them to fill out that can be faxed in or sent in, this is the form for the ND Quits line for that. And then a new thing that I have that I'm just giving a teaser for, because it technically doesn't launch until April 1st, which is Takedown Tobacco Day. But TFND has partnered with Truth Initiative. They're a national partner, and we're going to be bringing the This Is Quitting program to North Dakota for teens and young adults. And what this is a texting vape quitting program targeting kids and young adults ages 13 to 24. It's similar to the My Life, My Quit program, but different in the fact that it is going to capture those 18 to 24-year-olds that sometimes get caught between being too young for the My Life, My Quit, and maybe not as interested in the more conventional ND Quits. And so we're hoping that this will help be kind of a bridge between those 2 programs for people that need a little bit of extra support. It's 24/7 texting support, and it's interactive texting supported by AI. So it is a little bit different again, that it's not necessarily a live person, but it is very intuitive, and it's been customized to us and to North Dakota. And so TFND is in the process right now of working with our client manager at Truth Initiative to provide North Dakota specific information and wording and things that we want to see added into this program to make it a custom fit for our state. And then we'll be launching it with pre-made advertising, handouts, social media support, all types of things that we'll be able to use to market this across the state, and it will be free for all of our partners to access and use. And then TFND will be working to also promote and push it out across the state and providing print resources and other media flight resources and things like that. And so we're pretty excited. That's about all the information I can give you right now, because it's literally being built as we speak. And launch date is April 1st, just in time for tobacco days. So we're pretty proud and excited. And it's a 3-year commitment to start. And so it's not going to be a flash in the pan. TFND is investing in this for the long haul, and our hope that it was be just another enhancement to what is currently being offered, so that everybody benefits and everybody has just an additional resource to use in conjunction with what we already have that is working and great. So that's kind of our big announcement for today. So that being said, here's some solution, and here's my contact information if there are any questions. And before I stop sharing the screen, like I said, I can show this on the North Dakota website. And so if you want to have those, here's where you would order them. I know many of you might already have such things in your offices, but if not, here's where you can access that to get them in hand. I know the wallet cards and the fold-over cards are especially popular when I do booths out and about across the state. And then here is an example of the IndyQuiz referral form. If you were going to, help your patient in office get connected right then and there, they could fill this out, and you can help get that sent in so that they get kind of faster into that intake process. So with that, I'm going to stop sharing and see if there are any questions out there. I know that was kind of some fast and furious information as well. And our hope is, again, just to really refer people to the experts that we have in our state because they're doing a great job. And if we can help you do the same so that more and more people are making those quit attempts and utilizing the services we offer, that's our goal, and that's where we would thank you.
Thanks, Heather. It's like there's a lot of interest in your presentation. So you had mentioned you will share that, and when we send out the follow-up from this, I will be sure to include that.
Yeah, I'll get that to you this afternoon. I just want to correct those 2 typos I saw as I was talking through it today, and I'll get that sent your way.
And I think Kara wants you to update the logo too.
Did I miss a spot with the logo?
There's an old logo in there, so
yes.
she'll get that sorted.
Heather.
Okay.
You're killing
What was that?
You're killing me.
I'm sorry. I'm sorry. I don't even know. I didn't think I had any of your logos in there.
I will
get
help.
that sorted.
I will get you that.
My bad. I'm sorry. All right. I see something in the chat. Let's pull this up here. Interesting. Oh, killing me. Sorry. Oh, okay. Well, you guys are kind. Thank you as well for giving us your time and energy this morning. I know everybody has a lot on their plates these days, so we appreciate you taking time out to hear from our experts and then to let me have my 2 cents added in as well. I appreciate that a lot, and I'll make sure that the slides come out. And then next week, at the end of the week, watch for our big launch for the This Is Quitting program. We're really excited to have that as a supplemental resource across the state for our youth and teens and young adults.
I don't see any. Thank you for joining us today. We'll be having our next edition here in a month, and details on that will be forthcoming. So have a lovely day. Thank you.
Thank you, and thanks Abby and our team at DOH for all the help and support you provide us. We couldn't do it without you.